Hello there, welcome to the clinic. I think we're just about ready to start your examination, general health checkup with some new equipment. Hopefully you should find it very relaxing as well as educational. So first I have to just ask a few questions. Are you having any problems with your general health? Any allergies at the moment, such as hay fever? Now let's explore headaches. Any headaches? What about migraines? How often do you experience migraines? Do you tend to get the headache and the nausea, or is it more a visual type migraine? Headaches, frontal. Start with only with migraines, right? And sickness. Do you take any medication for the migraines? So sometimes you'll take some migraine relief. That's fine. Medication. Please list what you are taking currently. So I have Ramipril. Any sprays in the mouth? Any beta blockers? Any statins? So you're feeling okay? What would you score your current mood out of 10? Good, but dependent on the weather. So any seasonal affective disorder, would you say? Do you tend to feel more sadness, depression, those kind of things in the winter months? And how long would you say you've experienced this for? Right, and finally, any family history, health issues? This includes things like hypertension, hypercholesterolemia, diabetes, cancer, any ocular problems in the family. Right, so I'm going to get started with this medical once-over. I'll try and record the results with a pen and pad if I remember. First test is auscultation, essentially using the stethoscope, placing it on various parts of the body to have a little listen to your heart and your lungs. Right, try not to hold your breath, please. Just breathe in through the nose, out through the mouth. Now, deep breath in and out through the mouth. In through the nose, just hold it there, and out. In again, and out. I'm just going to gently tap on the chest here. deep breath in as much as you can and out through the mouth. Lovely. Just have a listen to the lungs. Just going to come round to the side, place this on the back. Just breathe normally. Excellent, thank you. So just listening to the chest there, the heart rate, BPM, seems normal. Actually forgot the term when I tap there. So we have ausculation. It'll come to it later. Right, one important test is checking your blood pressure. It can be a risk factor for things such as heart disease and stroke. So we're going to do it the old-fashioned way there. I'm going to place this just your arm, give it a little manual squeeze, inflate, and then I can check your systolic and diastolic readings. So, left arm out, please. It's now going to inflate. It seems we have an issue with the equipment there. Not to worry, I will try again at some other point. Right. I'm going to use my trusty reflex hammer of 15 years. I'm going to just take some measurements, just gentle tapping, so I want you to place the arms out like this, please. And the left arm there. We'll start with the elbow. And the hand there. Lovely. Right, I have my trusty thermometer here. Of course, you want to check your temperature. So first, I'm just going to place it in your left ear there. Excellent. We have the little smiley face there. And for the right. Yep, another smiley face. And let's just try in the mouth. Open wide and gently close there. And we have 3 smiley faces. Excellent. So upper body reflexes. Temperature. Super. Alright, I have my tongue depressor and dental mirror for a thorough check-up of gums, teeth, tongue and the rest of the tissue. So if you're ready, open wide please. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. Right, open wide please. Say ah. And again. Right, tongue to your right of the mouth. Tongue to your left. Relax the tongue, open wide again. Going to use some light from the otoscope. Uvula, bicuspids, tongue clear. Okay, I'm just going to place my fingers on the thyroid gland, just locate it, and I just want you to swallow there please. Okay, and I'm just going to have a feel of the lymph nodes. Right, since we had the otoscope in hand there, I will have a look inside your ears now. So please, you're looking straight ahead. You say you've had no problems with your hearing at all? degree, that looks okay. And for the left ear. Just a bit of light there. And if I could just feel the ears there for any problems. Now, I don't have my ophthalmoscope with me today, but I can certainly do an anterior eye health check with the otoscope. Gives me a little bit of magnification to view your ocular surface. So please just look behind me. Right, just take a blink. Now look up to the ceiling. Let's have a look at the lower fornix there. Good. Signs of any roughness, hyperemia, certainly no papillae. Okay, look down. Look at the superior conjunctiva. Look to your right hand side. And left. That's the temporal conjunctival surface. But I've not seen any evidence of pterygium or pinguecula. Lovely. And let me just check the iris. Just nice red pupils. No evidence of any depigmentation. Blink again. Okay, you're looking at my shoulder. Look at the left cornea. Right, and a little look at the lens. And the iris. Some light on the iris, good. Responding to light. Okay, and look up again, please. Good, nice, clear tarsal plate. Look down. Okay, look to your right hand side. And left. Okay, and relax. I was having a little look at the tear meniscus. Looks a little bit irregular in both eyes. No further pathology detected on the ocular surface. And prior to that, we had a look inside your ears. Right, as I was saying, there may be some evidence of dry eyes. Now, do you experience any soreness, grittiness, redness? Just the itchiness and sometimes redness. Fine. No grittiness? Okay, so I'm going to instill some ocular lubricants here, and then you can see how they make your eye feel. Look up, please. Right, how do those drops feel? Cool. Right, they are 0.3% active ingredient. So I want you to see how your eyes feel from now on. See if those symptoms reduce or even abate. And then, if they help, I'll ask you to purchase some of those eye drops. Right, so I'm done. Do you have any further questions? Correct, I'm going to get you back in for a BP check. That's what I'm going to do. I'll give you a call when the machine is up and firing again, and then we'll have you in. So that is it. Thanks for coming, and I'll see you in 2 years' time.